Hi, my name is Chris Centeno. I'm the medical director for Regenerative Sciences and also a medical doctor specializing in interventional pain management. I'm also a stem cell researcher, so I'd like to talk to you today about using adult stem cells to treat chronic bursitis and educate you today about chronic bursitis. What is a bursa? A bursa is a lubricating sac where there's some friction between a muscle or tendon and usually a bone. Now you might imagine that the body wouldn't do well if you had a muscle or a tendon that was rolling over a bone and there wasn't something there to cushion that or reduce friction. A bursa is nothing more than a lubricating sac that sits between those two. So as I've drawn this here, the red muscle, and you can see the bone underneath and that lubricating sac in between, as the muscle moves, you can see that the lubricating sac sort of moves with it. And that's what a bursa does. It just lubricates the movement between those two objects. Now, chronic hip bursitis, let's specifically talk about a patient, because it's always helpful to get a real person involved to learn about a condition and different options for treatment. This is a 56-year-old white female. She had a gastric bypass surgery, and we had some concerns about her overall nutritional status because of this surgery, although we don't know if that was the cause of her chronic bursitis. She was told she needed a hip replacement based solely on an x-ray, and regrettably we see that a lot these days. Insurance companies are putting pressure on doctors not to do MRIs. So this was a patient solely based on an x-ray that she needed a hip replacement because she had pain generally in the hip area. However, a diagnostic numbing injection into the hip joint didn't relieve most of her pain. That's a big problem. Obviously, we wouldn't want to replace a hip joint that wasn't causing hip pain. There are a lot of different things that can cause hip pain outside of just the joint. So that was a big problem. An MRI showed a swollen iliopsoas bursa, basically a different cause than the hip joint. Numbing the bursa took away most of her hip pain, so it was pretty clear that, it wasn't the hip joint that was causing her pain, but in fact it was the bursa, or the lubricating sac around the hip joint. Steroid injections into the bursa only helped for about a week, so we really couldn't go that direction to help this problem. To give you a sense of what all this looks like, you can see here this patient I've drawn in. We're going to be talking about the bursa in the front of the hip, and I've drawn it in there on the right. I've circled where that bursa is. You can see where the line is that says iliopsoas bursa. And that's the lubricating sac between the psoas major muscle and the iliacus muscle and the front of the hip. It's what allows those muscles to move smoothly over the front of the hip. And I've outlined in red what that bursa looks like there, so you can get a good sense that it's that kidney-shaped object, which is again a lubricating sac between those areas. And regrettably, the only other option for this patient outside of adult stem cells was to have that bursa completely removed. Now there's some very important structures near that bursa. One of them is the big nerve that controls the thigh muscle. So obviously that can be a risky surgery going in, opening up a big hole, working near those big nerves and taking that bursa completely out. Instead of an open surgery, what we did was to inject her own stem cells. So we took those stem cells out via a needle. We grew them to bigger numbers in culture over several weeks using the Regenexx procedure. And then we injected those cells under x-ray and using the MRI to plan where we were going to go into that bursa. The bursa here on the left, I've encircled in the white dashed circle, is the whitish area that you can see in there. You see some dark gray inside that white dashed circle. You also see some whitish area. That's a bursa that is swollen about 10 times its normal size. But you can see that several months after the injection of cells, she had great pain relief, And you can see there that the size of the bursa, or the amount of the white stuff, has gone down appreciably. So essentially, this helped this patient's chronic bursitis, and this is the MRI evidence of that. Again, this is very important because there are bursas all over the body, not just in the hip. So for more information, see Regenexx.com. But I think the take-home message is that adult stem cells can help chronic bursitis without the need to remove the bursa, but just an injection. And more importantly, that we're not only talking about chronic hip bursitis, but obviously chronic shoulder bursitis and bursas in other areas. There are bursas throughout the body, or lubricating sacs, that can be treated using this technique with just needles without actually an open surgery to remove the bursa. Thanks for watching. For more information, go to Regenexx.com.